Thank you. Thank you. Hello, everyone. I would like to, of course, thank the Pierre Fabre Foundation for having invited us during this conference and being capable of sharing our experience through our project. Teledermatology is the name of our project. Now, when we talk of dermatology in a tropical environment, we often talk about specific affections, lymphitis, or, for example, dermatosis, or in fact, these skin conditions have, in fact, a very clinical expression, and dermatology is quite worrying. Again, I spoke about different symptoms, leprosis, and that is why we need to organize our actions. But when you focus on these statistics, what do we see? We see, for example, that the chunk of these affections is less than 1%, and therefore it's maybe just the tip of the iceberg or the visible part of the hypothalamus. Now, most of the diseases are what we call ubiquitous cosmopolite affections, and that represents health problems. And what really creates a huge buzz is the fact that it could be considered as a public health problem. Now, we have several documents, epidemiology, for example, the fact that we have a high frequency of these conditions and a strong demand of skincare. According to the studies, we know that between 10 to 30% of the consultations are related to these. So tropical dermatology is the fourth reason for consultation. And then there's acute diseases, respiratory diseases, and diarrhea. Look at the complication. I think that really backs up our project. There's a physical disturbance. Here you have impetigo, you have diffuse rashes and bacteria situations. So this is, of course, quite problematic because this patient is no longer capable of moving, has to be bedridden. Now, when the population wants to consult a dermatologist, we call it a real problem. There's a lack and shortage of dermatologists. That is why they're going to go to nearby health centers. Unfortunately, very few doctors there, and especially the populations in front have little skilled health professionals. And so, as a result, they have a misdiagnosis, then the medication that is going to be prescribed is not going to be adapted, and therefore you have a cost versus a prescription that is extremely high. For populations which are often poor, have never been to school, they don't have drinking water, lack of hygiene, their lives are very difficult because of traditions, because of cultures. Let me give you a little anecdote here. One man, men don't wash with soap because soap removes the protection from decoctions, and therefore vulnerable from, I would say, other bad spirits. So once we know this, we also know that the health context is not favorable. We have a limited health budget, and then we also have health centers. This is the first contact point between the populations and the health services. And for these ubiquitous affections, there is no management. However, we see that the World Bank has published an article, and even the London School, and they show that very few actions can target these affections. With less than $1, you can treat 2 cases of scabies, and with that much money, we could, in fact, treat impetigo or scabies. So when you think about this, we have several arguments, and that is why we decided to start acting. Back in the 2001, tried to have a short dermatology training, and with this project, with very little information, you could improve dermatologic affections. For example, the number of patients who are managed, so you have between 45% to now almost 95% with the doctors. Same goes for the essential drugs. Prescription will drop once they get the information, and therefore it's going to create an impact on the cost of the drugs. Now, showing the results to the health ministry, and so that is why they decided in 2004 they encouraged us to have these actions throughout the country, and we have been able to support and fund. Of course, the Pierre Fabre Foundation has been very much present, and so have been health partners. Now, with time, we saw that with these affections, but also these actions, we were facing a couple of challenges. For example, the loss of expertise in health centers, the fact that we are lacking some derms with specialized skincare. We didn't have that. And given our specificity in the area of dermatology, and also the fact that the globalization of IT and also communication tools, we thought that maybe we can find some solutions for Africa and especially in Mali. So we thought that we have more possibilities with telemedicine. And when we looked at the literature, we saw that we have over 500 publications that really stressed on the effectiveness of telemedicine, and that is why in 2014, with the foundation, we decided to set up a teledermatology project. So the hypothesis was the following. If we have an application of IT, we could improve the management of these diseases, and that is why we want to set up a bridge between the doctors and the dermatology experts through a platform. And obviously, they're going to take pictures, send this picture to the dermatologist, and the dermatologist is going to help the diagnosis. And the idea is to provide initial training and why not phone calls. Now, that is how our colleagues have set up a platform. Bougou, it means help, and we used it in order to set up and connect this platform. We also looked at the level of health services, and so the expertise, of course, was based on telemedicine, storage of pictures with 10 health centers around the country, and then the action was about 18 months. And so we decided that if we needed to have a sufficient impact, we needed to assess about 100 patients with the average level of consultants. And so we reached 300. What about the expected results? Obviously, we wanted to improve the skills of these health officers and have the IT adopted and reducing the traveling also because of these exchanges with the specialists. Now, this was approved by the ethics committee, and therefore we have trained about 20 officers and the experts for these platforms, and then we have networked this with this platform. The training mainly targeted on the current dermatological problems. In fact, we had algorithms that also looked at IST, and then all this is a manual, and all this is given to the trainees. Now, the second day was only for computer, for those who did not know how to use a computer, and also how how do you use a digital camera, you take pictures, and the fourth day is how you use the platform. How do you use the platform? Now, all this, of course, have been backed up by clinical and technical supervision, and so there was a hotline. Now, after the training, we took a step back and we looked at before and after. We saw that 40% of the centers had no internet connection, and a lot of people had not been using a computer. Now, when we started doing our derm consultation, we have seen a certain level of improvement of these consultations, and that is after the platform was set up. For example, 20 officers have been trained, doctors and nurses, 100 patients were treated, and the response delay was 30 hours, and only in 6 cases we were not able to find a satisfactory response. So the impact, you saw that throughout the year we have had some cases, a big, quite drop in January because people visit less these centers. Now, when you look at the reasons for consultation, what is the profile of these affections? We see that for eczema, mycosis, pruritus, prurigo, and also bacterial dermatosis. Now, matching this and benching this to all these specialized centers, we saw that it's exactly the same profile: eczema, mycosis, bacterial dermatosis, and prurigo and pruritus, and finally the bacterial dermatosis. What about the skills of these health officers? We also wanted to ask the question, why do you, what is the improvement of these officers? Because when they go on the platform, they say there's no problem. So in Pedigo, for example, after about 7 months, they were able to diagnose this. So when they had their medical examination, they said that they're very satisfied. I learned a lot, and I have been able to gain respect and consideration. And so they were happy. What about the satisfaction of the patients, of the users? We were able to highlight this with the feedback that we got, the testimonials from the platform, but also some satisfaction surveys. They said, only 1 week later, I can see the improvement, so God bless you. Now, this means that we're very encouraged to promote these initiatives on other countries by following the exact same strategy, and also giving priority to the northern regions, the structures also that have a good internet connection, with a meshing of the country over 2 years. So you see, we decided to start with the northern part, but now 80 centers are now covered. And so for that, we're going to base ourselves on the experience, but also the help of the derms, and especially our experts that we have trained through the platforms, and also having a political solution. Of course, there are challenges, there are some constraints, because there's a lot of insecurity, but at the same time, we have to justify this, because people do not travel. They don't come to Bamako to get health care. So as a conclusion, we say that it's a very original, innovative initiative, research action. It's never going to replace what is already there, but on the contrary, it's going to add up to the health system, to the health services. Again, our aim is not to substitute, but rather improve, and it's also a great entry for a lot of health services. So thank you again to the foundation, Pierre Fabre Foundation, for their financial support, Health Ministry, the CELTEP, and we are also visible on Facebook through our website, Certes, and Facebook. Here you have the link towards the platform, and I'm not going to have time to present this. Thank you very much for your attention.